capacity to be able to memorize the sounds within that system, rapid naming, the rapid retrieval of that information from long-term memory, and of course the phonological awareness, the capacity of the brain to pick up those sounds. The second component of reading is fluency, and fluency is defined as the ability to read quickly and accurately and with good understanding, is the hallmark of a good reader. In order to read accurately, we have to be able to have good phonological skills, however. Fluency will ultimately be acquired word by word, and that's how we develop what we call sight vocabulary. The goal from reading is to go from sounding out a word to be able to recognize the visual configuration of the word and to make the connection for what that word meaning is. What we know is that in dyslexia we have a deficit of the phonologic module. The ability for the brain to process the sounds within a word is critical to understand language. And the brain can discriminate background noise from words. Individuals that have problems with the phonologic module have difficulties processing the sounds within the words that they read. That's what we do naturally. However, reading is not a natural biological process, and we must borrow from different parts of the brain to be able to learn to read. What we know about the neurobiology of reading is that we have two areas of our language system that are affected. One is the part of the language system that analyzes the sounds within the words, and the other one is the one that ascribes a word to something that we see. In this diagram, what we see is on the left, an individual that reads, that is a typical reader, will activate three areas of the left brain. What we're looking at here is the left hemisphere. So if you think of someone in front of you with the nose pointed to the right, you will be able to determine, to see that part of the brain. It's like if we peel the skull of that individual. And what we see is that speech is processed in that part of the front of the brain, the phonemes are processed in the middle, and the visual word is processed in the back of the brain. The individuals with dyslexia do not activate the two parts of the brain in the back. These are functional MRIs of the brain from Dr. Guinevere Eden's lab. Dr. Eden is the president of the International Dyslexia Association, and she works out of Georgetown University. And what this shows is a typical reader's brain when they are asked to perform a task such as eliminating a sound from a word. For example, if I say the word dyslexia, if I take the D sound out of dyslexia, I would say dyslexia. And that is what this task is all about. So on the picture on the left, we see the left brain, and we see the activation on the three areas that I showed you previously, and now we see on the picture of the right, very little right brain activation. In individuals with dyslexia, however, what we see as these pictures show is that the activation of the brain is in a different area. If you look at the figure on the right, there's much more activation in the back of the brain, where in the picture of the left, the activation is mostly on the left side of the brain. So if we're going to look at what happens in the brain of a child as we're processing phonemes, if they're looking at the word cat in English, they would begin to sound out the word and say the sounds k, a, t, and then put them together and say, aha, that means cat, and then the image of a cat would appear. The goal is that after the child has learned the letter sounds and has learned to blend those sounds together, that they will recognize the word cat, so that we can look at the word cat and automatically it leads to the concept of cat. And this is where fluency comes about. This is at the root of the neurology of problems with reading. If we were to look at a formula for reading, what we must have is decoding times fluency plus comprehension. The D and the F in this formula are in red because that is what we teach. Comprehension is the individual's capacity to understand what has been said, and that's part of the nature of the child. So if you were to have a value of less than 1 or 0 in the D or the F, you would see that you would have a problem with reading. And what this formula suggests is that where we need to emphasize the intervention is in decoding and fluency. Why? Because if we cannot decode and read fluently, then we're going to have difficulty with word identification, which may ultimately lead to poor vocabulary development, concept formation, and reasoning, and that would have a significant problem for the child. When we're looking at early identification, the sooner we can help these children, the greater the impact we're going to be able to have. So we want to make sure that we're going to look at the critical skills for reading that are going to help us identify them early on. These include phonological awareness, automatic, accurate letter naming. Remember, the rapid retrieval of information is very important. Letter and sound association, the capacity to read words accurately and fluently, and ultimately passage reading, fluency, and comprehension. So we will go from word reading to sentence reading to paragraph reading. Again, if you remember the basic functions of language, we're going to go from sound to word to sentence to discourse. The early signs of dyslexia, if we look at them by age, what we're going to be looking at is based on their experiences. The first thing is delay in speaking, difficulty with pronunciation, insensitivity to rhyme. The reason why we can rhyme is because we can recognize that different parts of the word may be similar or different, and in order to do that, we have to process their sounds. We may have difficulty with word retrieval or word finding. And if we have had proper instruction, then the last one, naming the letters and their sounds, is the last thing that we look for when we're trying to screen for children that may be at risk for reading problems. So if we look at an infant or a toddler, what we need to know is that the child should have the first word by 12 to 15 months. A child should have phrases by 18 to 24 months. And I think that that's important to look at. If you want to remember it in a very simple way, 1 word by 1 year, 2 word combinations by 2 years and 200 words, and 3 word combinations by 3 years and 300 words. That's how we look at the history. If there's a family history of developmental delay or dyslexia, that is very important because these disorders tend to run in families. In the preschool years, what will we be looking for? If a child is 5 or 6 years of age, they should talk like other 5 and 6-year-olds. They should not talk like a 3-year-old. Look for omission of sounds. Initial sounds and ending sounds are very common, but we can also omit middle sounds. So we need to look for those mistakes. Also, the change in the sequence of the letters, inverting sounds or changing them. Insensitivity to rhyme. If a child cannot rhyme, if they cannot memorize nursery rhymes, if you can ask the child to give you a word that rhymes with cat and they cannot say hat, then we know that there may not be attuned to the word parts, and that could be a problem. Another important thing is when a child uses circumlocution. A common expression is, I have the word at the tip of my tongue and I can describe what I want to say. If I say, oh, I need that thing that you used to write with, that writes with ink, you know that I'm referring to a pen. Some children may refer to it, as a patient of mine did, as the ink pencil because he could not think of the word pen. Another way that you may find this in children that are already reading is a child that substitutes words. I had a patient who had difficulties with word finding and was reading a paragraph where there was a sentence that read, "The girl is beautiful." And he read the sentence as "the girl is pretty," which are totally different words. So he recognized the word beautiful and knew the meaning of the word, but he could not come up with a precise word. So he